Hi, everyone. Welcome to another live stream. Okay, we need to talk about what's going on in Hollywood because I know you want to know and I want to know. And I've been seeing this all over my feed. I've been seeing it on Instagram. I've been seeing it on YouTube. I've seen tons of plastic surgeons make reaction videos about this. And it's crazy. It's crazy what's going on in Hollywood. And it's something that I've never seen before because there are so many celebrities kind of emerging this year or late last year who look exactly like they did when they were in their 20s or early 30s. So there was this whole cosmetic procedure era that we were in where people were looking very inflated. They were looking like they had work done, right? So you could tell that they were going in for procedures and they were getting work done. Some of them still looked great, but they looked done. And all of a sudden, we are now in this era where celebrities are showing up and they just look like they did 20 years ago or 15 years ago. And it is mind-boggling. I know that you guys want to know what's going on. I sure as heck want to know what's going on. So I brought back one of my favorite people ever to talk to you guys and give his insight on what the heck is going on. So let's welcome Dr. Corey Goldberg to the live stream. Hi, Dr.
Gabriella.
Goldberg.
Hi, Gabriella. Nice to see you again. How are you doing?
I'm doing so great. It's so good to see you. Thank you so much for coming back on the show. We loved having you last time.
Oh, thank you so much. Well, it's my pleasure. I look forward to this conversation, and I think there's some fun stuff we're gonna talk about.
Yeah, it's gonna be a good one. And everyone is hopping in. I can see all the numbers going up right now. Hi, Valerie. Oh, hi, Monica. Thank you guys so much for coming in. You guys, as live streams, like every live stream, I really love to see your comments and for you guys to engage with each other and be a part of this conversation. We see you, we'll pop you up, we'll answer your questions. It really is for all of us to be together hanging out. I wear like my comfy clothes. We're just hanging out and having fun together. So it's going to be nice to see what Corey has to say. So first off, has your practice been asked, like, have people been coming into your practice asking about these transformations a lot? Like, is this something you're hearing about constantly?
You know what? It really is. And the past 2 months, especially, patients are asking about it. Even the nurses in my surgical facility, people are coming up to me and showing me pictures and ask, "Hey, what's up with Lindsay Lohan?" And I'm like, so I kind of feel like I've been forced to look at these things and see what's going on because you're right. It is a definite change in the industry and in what people are getting done.
Yeah, there's been such a shift in the trends of beauty. And honestly, I'm really loving where it's headed. Not that I don't like the way that it's headed in the sense that everyone feels like they need to look flawless. I think that's dangerous. But I like that we're moving away from these really overdone looks where people just look rejuvenated, but they still very much look like themselves. It's a very big shift.
It is a complete shift, and you and I align very much on this. And even though I'm a plastic surgeon and I do these things for people, I don't like what's happened to the industry over the past couple of decades. I don't like the overdone appearance, and I don't like the pressure that has come to people to have that flawless look. You're absolutely right. No one is perfect. No one is symmetric. It is our individuality that makes us unique. So I agree with you. The idea that everybody should getting this kind of stuff, that's not right. But the overall approach to patients and achieving a more natural look and avoiding exaggerated appearances, I fully support that. And I really think that the industry is starting to correct what it's done over the past 20 years or so.
Yeah, that's exciting to hear. I can't wait to get your perspectives on all of this. So why don't we start by looking at some celebrities? Are you okay if we pop up some pictures and then you can tell us what you think they've had done just from your trained eye?
For sure. I'm happy to chime in. Look, I may or may not be right on what I predict, but I think I have some insights on the people you're going to bring up. So bring it on. Let's see.
All right, guys. Donatella Versace. This is a big one.
Yeah, you know what? Honestly, I think this is a great place to start. Donatella, I feel for her. The pressure in her world to have that youthful, rejuvenated look drove her to extreme, and I think that she is the poster child for the overdone, non-surgical approach that people followed for so long. She in her before picture here, she is so overfilled and overdone. Her upper lip is gigantic, and the crease in her cheeks from being overfilled. That at her lips, I mean, oh my goodness, those lips, how much filler does she have in those? So, really not healthy, but yet at the same time, looking at her before, she's still very hollowed under her eyes. There's still shadowing there. So, and you can see she's wearing her hair down and forward to hide what's going on behind there. She's had facelift surgery on top of all this. So now she's hiding her scars. They were probably fairly visible. And then in addition, she has all this filler. So fast forward and where she is at now. So first thing, a lot of that filler is now gone. Her cheeks have been deflated. The almost certainly dissolved away some of that filler. Her lips, wow, I mean, night and day, still full, and almost certainly there's still some product in there, but she has definitely decreased what she's used. And so, I think the biggest change for her is the dissolution of her filler. And at this point, I would say she's probably had some fat grafting. So her lid cheek junction, that kind of fullness that she has just below her eyelids, that is not something you can really achieve with fillers because it ends up causing a lot of swelling. And fillers along the lower orbital rim there will tend to, you can actually see through the skin because the skin is so thin. It causes this weird bluish coloration. It's called the Tyndall effect. So that's why we're really cautious about filling lower lids or lid cheek junction. But hers are nice and full. Almost certainly that's some fat grafting she's had there. So I think for her, the biggest thing has been, get rid of filler, shift to some fat grafting. And I think those are her biggest changes. Also, her brow looks more elevated. So I wouldn't be surprised if she's had a brow lift. That before picture, she has the 11s there. Still some activity in between her eyebrows. That's the procerus muscle, her glabella. Those worry lines, now they've softened up. I don't think that's just Botox. She's probably had a brow lift, and part of that is sort of relaxing those muscles between her eyebrows. So that's it. I think her eyes look more open because of the brow lift. A little bit of fat grafting, get rid of all that filler. And there you go. And I think she looks super, and wow, what a turnaround.
Taking all that you're saying, I just watched an entire video from another plastic surgeon talking about the dangers of filler, because filler was such a huge thing for so long. And for a long time, people would say that they're completely safe. You put them in, it lasts for about a year, maybe 18 months, and then it dissolves. But now there's more and more evidence to show that it really, some of it does dissolve, but a lot of it is left in the skin. And as time goes on, it gets kind of mixed up in there and it becomes almost impossible to dissolve and can lead to a whole host of other issues. Would you agree with that?
Absolutely. I completely agree. And the one thing I would alter, you said almost impossible. I would say it is impossible. Once you put filler in, there's some residual left over years down the road. And depending on certain parts of the face, especially those lower eyelids or the lid cheek junction, that area, the product will last 5 years, 10 years even. And the thing about the dissolving, the way we dissolve filler, the fillers that are hyaluronic acid based, they respond or dissolve with hyaluronidase. And hyaluronidase, it's an enzyme that's something that can break down hyaluronic acid. When you inject it, we've always kind of called it's the antidote. It is, because it does digest away hyaluronic acid, but hyaluronic acid is a substance that's actually part of you. It's part of your cells, it's part of collagen, it's part of cartilage and skin. So it's not that it just targets filler. So when you dissolve filler with hyaluronidase, it doesn't get to everything. The filler is kind of dispersed. It's like molasses inside of a sponge. You can't just get at all of it. It's spread throughout the tissue. So there is no complete antidote for filler. And if you operate on patients who have had their filler dissolved with the hyaluronidase, you can actually see it. It has this kind of yellowy, viscous, sticky feel, and you can actually scrape it out. So to your point, once it's in there, something is left behind. And I don't want to completely, negate fillers. There is a role for them. Responsibly used in good amounts in the right parts of the face, it can be very beneficial. But that's definitely not what we've seen. The past decade or two, we've seen people with these gigantic overfilled faces chasing a dream that they want to achieve a surgical result with a non-surgical tool, and
Yeah.
it's simply not possible.
Yeah, and that's the video that I was listening to just earlier today that was really eye-opening for me, because I think we try, and I think we've been actually trained by media to think we have to stay on top of this so that we don't get older looking faster. So the way we stay on top of it is by maintaining our Botox, by getting our filler done every year. But then what happens is that as we keep filling and things aren't dissolving, and then we lose skin laxity, you end up with this heaviness here because you have skin laxity issues and these gigantic cheeks and everything. You have hollowness still because you can't put filler there. So you end up with these huge cheeks, these huge lips, and this really hollow, like skeletal look with skin laxity issues. And then you're trying to correct for this whole mess that you've created, but we've been doing it to try to maintain a youthful look. So it's like, frig, like this is all coming out now, you know, and it freaks me out. I'm not going to lie. I've had filler in my cheeks probably 3 or 4 times. And now I'm like, oh God, what did I do?
You know what? I don't think you have anything to worry about. You are not overdone, and the little bit that you have in there, over time, it will slowly break down, and maybe there's a little residual left behind. Honestly, it's not the end of the world. Look, if you do surgery on someone, what's left behind is some scar tissue, and no matter how good you are as a surgeon, as soon as you open up tissue, it heals together with some scar. So everything leaves something behind, and I guess that's an important thing. You know, there's no such thing as there's no free lunch. You know, anything that you choose to do, there is a consequence to it. There are disadvantages, and in the end, you really got to weigh what are the positives and what are the negatives. What are the things that you're going to gain versus the things that you're giving up or the risks that you're being exposed to, and you got to balance that out. I think the thing that's happened in the industry, this non-surgical, that slippery slope that you just described, I think that happens because a lot of places only offer non-surgical, and so that's their tool. And someone comes in and they say, "Fix me." And well, if all you have is a hammer, everything is a nail. So when you see someone and they say, "Fix me," what are you going to do? Well, I have filler, so I'm going to put in more filler. And people over time, their image of themselves rewires. I think we talked about this in our last conversation about cortical plasticity and the sort of way your brain sees itself. When you have that self-image over months, it shifts. So when you get that filler put in, a few months later, you don't really see it. People come in all the time. I don't see my filler. It dissolved away. And then you look at their before after, you're like, no, it didn't. People don't see that. And so, you know, the indiscriminate clinician sees the patient and says, no problem, I'm going to fix you up. Let's put in some more filler. Let's put in more and more and more. And then you end up with these people with these huge overfilled lower faces and lips. And really, it's our responsibility. It's the clinicians. I am ashamed of our industry because we have allowed this to happen. And I have been waiting and screaming about this issue for so long. And I'm thrilled to see that it's finally coming back to normal.
Yeah, absolutely. So we've had a lot of questions in the active chat here. I love that you guys are chatting about Demi Moore. Okay, I know. I was shocked myself when I saw her on the red carpet. I'm like, holy smoke, she looks incredible. So let's pop up Demi Moore and tell me everything that you think.
Yeah, gosh. I mean, Demi is, she looks amazing. I think that she is doing so well. And, you know, I want to say her after picture, one really important thing to note is she has a pretty significant amount of facial asymmetry. However, if you go back to her early pictures, as you know, in childhood, she always had a bit of facial asymmetry, and it's totally normal. And I think it's a good thing to hammer home with patients because, you know, everybody's face, there's always one side that's bigger than the other. The two sides never match perfectly. So I think some people might look at Demi now and say, oh gosh, you know, why there's asymmetry there? She always had some. So that's not unusual. But let's talk about what happened. I mean, looking back at where she was, the almost Joker look that she has to her smile, that almost downturned and kind of pulled out corner of her mouth, combined with that line along her cheek on each side. What I see there is over tightening, and I suspect what she had done is a type of facelift. And it's some people call it a composite facelift, where the deep plane and the skin are attached together and moved in a single direction. And the problem is that when it comes to facelift surgery, one of the most important things is the vector or direction that you pull. So the deeper tissue, the SMAS layer, that deeper tissue really needs to go almost vertical with a slight back angulation. It matches the angle of the muscles that move your mouth in a smile. And then the skin itself actually needs to go more up and back. Not quite a 45-degree angle, but definitely more on an angle from the corner of the mouth towards the ear, let's say, sort of as a rough idea. So given that the deep plane is meant to go up and the skin is meant to go more back, if you don't do that and you try to pull both together, you can really over tighten and pull things. And I think that's what happened to Demi. So, I mean, her cheek, that kind of drawn look, I think that was an over tightening in a single plane facelift. That was an issue. The other thing that it could have been, there are permanent threads that can get used that could have potentially pulled along those lines and caused that. So, I mean, she's certainly had a facelift before. There may have been some threads put in to try and maintain that. Again, on the non-surgical side of things, there are dissolvable threads and non-dissolvable threads, and we talked about that in our last conversation as well. Dissolving threads are fine, and they're safe. They dissolve over time. There are non-dissolving threads that some people use with promises, and I wonder if she might have had that as well. Because looking ahead, so her after, very clear change. She now has nasolabial folds that she didn't have before. Right, that before picture, the line from the corner of her nose to the corner of the mouth, it's been obliterated. That's from overfilling and that weird angle of pull on her mouth. Now she has nasolabial folds again. Those have been created, and it's partially from proper lifting internally of that deep tissue, the SMAS layer, in the right direction more vertically, and that's helped to recreate her nasolabial folds. But if we go really close in, and I've looked at a close-up of Demi, there's actually a couple really small scars right next to her nasolabial fold on each side. It looks like somebody had to go in and dig something out. And the scars are very minor, but it's a bit of a sign to me that there was something there that someone needed to remove. And so that either there was a thread or she might have been, given some permanent filler. I've definitely seen patients with various types of don't do permanent filler. There's no good permanent filler. That doesn't exist and never has. So somebody went in to get something out because there's no good reason that there would be little scars next to her nasolabial fold otherwise. So that's it. I think she had her secondary facelift. I also noticed her nose. The first picture, she's a little bit on an angle, but I've looked at a couple of other pictures of Demi. I think she had her nose refined because the tip is now straight and a little bit narrower than it used to be. So I think that softened up her look a little bit as well. So that's my thought. I think she had to have her facelift fixed, and I mean that before picture is really that's not a good facelift. That's an issue. Don't her cheeks have filler? Yeah. So she has volume in her cheeks. Thanks for the question, Doreen. I agree that she has volume there. She had some volume there before, and in a facelift, when you're dealing with the dual plane, when you're dealing with the deep plane and the skin, in lifting up the deep plane, you're actually taking the tissue of the cheek, the fullness, and bringing it up higher. Which gives the appearance of filler, but it's doing it in the most natural possible way. It's doing it the right way. It's actually lifting up the cheek tissue and fat that's now sagged or lowered. So you're reestablishing the fullness back where it belongs. It's in fact the most natural and best way you can do that. So what she may have some filler here or there for sure, but I would say part of the fullness that you're seeing in her cheeks is from the facelift itself.
No, it's fascinating. See, this is the thing, and I really feel for celebrities. I mean, so much of their profession revolves around their appearance. For women, an enormous part of the roles they get and how they're, loved and admired and adored. Like, look at Lindsay Lohan. She's suddenly like adored by everyone because she looks good. You know what I mean? It's so much pressure. And I think you so very quickly lose perspective, and things that are natural and normal, like nasolabial folds, we have them for a reason, so our mouth can move. You start to just narrow in on these little things, and you fix them to the point where all of a sudden it looks really bad. Not having nasolabial folds is not the goal.
Yes, you're absolutely right. A lack of nasolabial folds, there's a word for that. It's called simian. So simian is a Latin word. It's talking about monkey, right? So the simian or monkey look, monkeys don't have a nasolabial fold. And so when humans start to get to that point where there's been filler and pulling such that there are no nasolabial folds, it's not rejuvenating. It makes you look weird. You look simian. You look like a monkey. We are supposed to have nasolabial folds. So that's a very important point. The other thing that you mentioned, which I think is absolutely right, is the idea that we look at features. Beauty is holistic. You are beautiful for your whole, your entirety. And when you look at another human, you don't look at one feature. You look at the whole. So, in neuroscience, there's the concept of the grandmother cell, and the grandmother cell is the cell in your brain that fires when you see your grandmother. But to get there to that point where that cell recognizes grandma, your eyes have to take in what you see, and it takes in all the features: the eyes, the nose, the shape of the jaw, the hair. All of it gets simplified and factored down into this one piece of information of, yes, that's grandma. So when you look at somebody, you don't look at all those different parts and pieces and see what's going on. You look at the whole. And so with regards to beauty, what we've now done is we've started looking at individual features. You look at somebody's lips and say, oh, I want fuller lips. And you think if your lips are fuller, you're going to be more beautiful. But then we get the Donatella Versace's of the world, whose lips are gigantic. Does she look beautiful? Well, of course not. And it's the same thing with noses. People look at noses and say, well, I want my nose to be smaller and smaller and smaller. Then you end up with a Michael Jackson nose. That doesn't look normal. Beauty is not just the sum of parts. It is a holistic entirety. And that's the way we look at people and perceive them. So when the beauty industry has gotten to a point where you look at individual features and say, put more here, make these lips bigger, make this part tighter. When you do that, you could look at each individual part and say, oh, that's really nice. But when you look at the whole, people look weird. And so all the weird looking celebrities out there, that's really the root cause. It is trying to break down beauty into those individual features rather than looking at somebody as a whole.
Oh my gosh, that's so, yes, that is like perfectly said. And and I think it's something a lot of us struggle. And I can see it a lot in my comment section too. These women really, there is such a struggle with that. There's a whole rise. Have you been noticing a rise in blepharoplasty too? I feel like everyone and their sister is getting blepharoplasty now. Even like 20-year-olds are getting it now.
Yeah. You know what? It's a good question. So I as you know, I'm a craniofacial surgeon as well as a plastic surgeon. So I have a strong focus on facial surgery and facial aesthetics. I have always done lots of blepharoplasties. There are a lot of plastic surgeons that don't. Facial surgery is a bit finicky, and a lot of plastic surgeons prefer to stay in the realm of breast and body. So blepharoplasty has always been common for me. But I have undoubtedly in the past few years seen more, and it's increasing. And I've had lots of young people asking about it. Today I saw a 30-year-old asking me for blepharoplasty, and it's something that needs to be done very responsibly. So it's not necessarily that there's too young of an age. However, for a younger person, there needs to be specific features to make it a good thing to do for somebody. It's not like everybody needs a blepharoplasty. There are some people who are born with very heavy upper eyelids, where even as a child or in their teenage years, there's hooding and heaviness. And that is actually a normal variation. I would say 5% roughly of the Caucasian population has that. And in my opinion, I think it's an exotic look. A very good example of someone who had that is Renee Zellweger.
Yes.
Renee Zellweger had heavy upper eyelids and those folds. I think she was beautiful. I still think she's beautiful now, but she looks different. And she had her upper eyelids done, among other things. And a surgeon who did her upper blepharoplasty was, in my opinion, overly aggressive, and it changed her look. She doesn't look like herself anymore, and she's still very beautiful, but now she's changed. So to me, when younger patients come in asking about it, first off, you have to say, are you the right candidate? Because there's lots of people who are not, and I turn people away for that. However, if it's a young person that has that configuration where their eyelids truly are heavy, if done conservatively and following the natural crease kind of from the inner corner of the eye, the normal curve of their fold, if you place that perfectly and you're conservative on what you remove, it can be really beautiful and make people super happy. But those are there are definite caveats to that. You got to be really careful as a surgeon taking that on and do it on the right person to the right extent.
Yeah, absolutely. Carrie's saying Demi has also had quite a bit of makeup contouring on her face in the previous photo for a fashion show, emphasizing even more the potential incorrect facelift. Yeah. makeup really does highlight things quite a bit.
Well, you know this better than most. Obviously, this is an area of your expertise, and gosh, indiscriminately applied makeup is probably almost as bad as indiscriminate surgery. I mean, you can make someone look really not so good with not well done makeup. And conversely, you can do miracles with makeup and contour. So, that definitely goes both ways. But Kiri, I agree with you. I think that her look was that makeup didn't help her.
Yeah. All right, let's move on to another one, you guys. This is one that's been blowing up my feed very recently. Christina Aguilera. So just a little caveat here. So obviously Christina in the before photo is very, very young. And then this is her now, but she has come out from underground and everyone's like, what? So how do you feel about her look and what do you think happened?
Well, I think she looks super, and again, I think she looked super before, and she looks super now. But let's try and piece apart what's happened. So, I guess one thing to comment on is that there's been a pretty significant weight fluctuation for her, right? There was the period where she was, heavier, and her lifestyle may not have been as good as it could have been. She has lost a ton of weight. And your guess is as good as mine whether there was Ozempic or anything related to that. But one way or another, she has really slimmed down, and that definitely changes her facial features. So I think that that's a big part of what we're seeing here is her weight change. Other than that, she's almost certainly had a little bit of filler here or there. I noticed that her jawline, although we can't see it as well in this picture, she had a much more curved jawline previously, and now it's really very angular. So I don't think she's had jaw implants. You can get implants at the corner of your jaw to give that. I don't imagine it's a pretty big procedure. I don't know that she went down that road. I'm guessing that she just has some filler along there, giving her that really angled look. But from the front, when you look at this after, you can really very clearly see that corner, and she didn't have that before. The other thing is her chin. She always kind of had that long, slightly pointed chin with a little bit of hollow beside it on each side. Her chin is still nice and prominent, but her jawline now is straight. So either she's had implants along her jawline, which, again, is possible. It could also be accomplished with some filler there. So, for her, the jawline and angular corner of the jaw, I think, is a big change for her. And that's, part of her weight loss. Her nose also, I think the tip of her nose also got narrowed a little bit. So I imagine that she's probably had a rhinoplasty, maybe a second one. I think she had one earlier in her career, and maybe had it just tweaked and touched up a little bit. Last thing, possible that she had a brow lift. Her brow does look a little higher, a little bit more arched. But I mean, that could be contouring, plucking, or her makeup there as well. Her neck, I wonder about her neck, because her neck is now really defined. And again, some of the other pictures of her, you can really see the structures down there. It's possible that she had neck lift done to achieve that. It's also possible that it's part of her weight loss. So, I don't know that I would say either way for sure. But certainly that would also contribute to a stronger jawline. As soon as you tighten underneath here, you can also sculpt fat underneath the jawline. And that would definitely give you an even more cut look along the jaw. So, I think jawline is a lot of is filler and kind of contouring. She may very well have had a neck lift to enhance that, to sort of give that little extra bit of tightening.
Amazing. If you lost so much weight, wouldn't you have loose skin?
Yeah, it's a great question, Carolina. So yes and no. It really depends on the amount of weight and the age you are when it happens, and also your overall nutritional and health status while it occurs. So, needless to say, the amount of weight you lose determines that. If, someone loses 70, 80 pounds more, that amount of skin would be a massive amount. 30, 40 pounds, it then very much depends on how old you are when it happens. If you're 50, 60 when that happens, you can be sure your skin is stretched and is not going to respond so well. If you're in your 30s, not so much of an issue. Your skin is way more resilient at that stage. And also, Christina didn't have a lot of weight fluctuation. I mean, okay, sure, at one point she got a little bit bigger, but that was one event, and whatever amount of time that lasted for, there are people who yo-yo up and down, and if your weight goes up and down, that means your skin stretches, loosens every time. Adds insult to injury. Same thing with pregnancy. Multiple pregnancies stretch things out more each time. Your skin loses that resilience. So the fact that you really only had that kind of one episode of a bit of weight gain, when she loses that weight, the skin tightens up. Also, looking at her overall health status, she's a Hollywood star. She's got a private chef. She's eating good food, and good food makes for good skin. And I can be darn sure that she is doing lots of great skincare as well. So the quality of your skin very much depends on skincare, also diet, and internally what you do, and exercise. Fitness makes a huge difference in your skin. So Christina, super healthy, so her skin tightened up. So my guess, she still wears her hair up. It's no matter how good surgeon you are, if you do a facelift, there are some scars around the ears, and I don't think that she's had that done. There are minimally invasive facelifts of this sort of ponytail lift where you can do just behind the ears, but Christina still wears her hair way up in a ponytail. If there was something behind her ears, I think it would be visible. I don't think she's had that. Possible that she did, but my best guess is I think her skin was able to contour to her weight loss just based on her health and the fact that there wasn't that much there.
Okay, so Jezebel is saying, Jezebel, I hope I'm pronouncing your name right. It's a beautiful name. Xtina had a ponytail lift or partial lift and some under the chin lipo filler for maintenance and upkeep for decades. So let's transition into, guys, we're going to talk about Lindsay Lohan, okay? Stick around. We're going to talk about her. But I've been hearing this term ponytail lift like crazy the last 2 weeks. What the heck is a ponytail lift? Tell me everything.
There are sort of different levels of a ponytail lift, and it's not a medical term. There was no moment in my training that I was like, okay, I'm learning the ponytail lift in today's lecture. So it's one of those things that it's a combination of different strategies put together. And these strategies are minimally invasive ones. So the idea of doing a brow lift through minimally invasive incisions in the hairline, doing neck contouring through a minimally invasive incision back behind the ear or underneath the chin to get at fat contouring on the neck and tightening up the neck. Those are ponytail lifts, and the more aggressive ones then actually do get into just facelifts. The most aggressive definition I've seen of a ponytail lift is basically just a facelift and a brow lift. So it's in our industry, there are a lot of things that get done that are given terminology because you can market it. If I'm the inventor of the ponytail lift, then everyone has to come to me for a ponytail lift because I'm the guy that does it and invented it. So, over the years, I've seen lots of different terms become mainstream. And I'm like, that doesn't mean anything. And there's no literature that describes that. You're just describing what you do and giving it a name. The vampire facelift, PRP for the face for skin quality. The guy who made the vampire facelift trademarked it, and nobody else could talk about a vampire facelift. So these terms, you got to be cautious in how you interpret them. So ponytail lift is really the concept of using minimally invasive techniques to try and tighten things. And there are a few different ways of combining that to try and achieve best results. Obviously, you got to pick the right procedure for the right patient.
Do you do those on younger patients?
So, yes and no. Again, similar idea to what I mentioned about the upper eyelids. I will operate on a younger patient if it's the right thing to do, if I feel like there's something there that's worth getting at that can make a difference, and doesn't expose the patient to excessive risk or long-term consequences that they're not prepared for. So I don't market a ponytail lift. If you go to my website, I don't put that there. But I certainly do minimally invasive brow lifts, and I will do minimally invasive neck lifts with incisions under the chin. So I put minimally invasive together in a way that I think achieves the best results. And I look for the right technique for the right person. And honestly, sometimes that means either telling someone you're too early, it's not the right time for you, or if you're here and we're looking at this, we're looking at doing an actual facelift. The minimally invasive surgery, there are benefits to it, but there are disadvantages because you lose some control in those procedures. So, there's no fix all. To say everyone should get a ponytail lift is, I don't think that's the right strategy. There's no one right tool that fits everybody.
Yeah, absolutely. Ella's saying here, I lost a lot of weight and I did face and neck yoga and I use gua sha daily. It really helped with the loose skin. How do you feel about face yoga and that kind of avenue of aesthetics?
I think that is a great avenue. I'm a surgeon and I love doing surgery and fixing things and giving people what they're looking for. However, there is no doubt in my mind that the best way to maintain youthfulness is health. Youthfulness is a healthy appearance, and I think those strategies, the yoga, good nutrition, all of that stuff, that really does help skin. It improves skin quality. Facial yoga, facial exercises can actually tighten facial muscles, and that can lead to a sort of tighter or more lifted look. In the end, the fiber tissue in your face, you can't tighten that without surgery. However, the muscles in your face, you can absolutely tighten and shorten. And so, exercise, another thing that does that, there are sort of magnetic stimulations of muscles. There are machines. M-Sculpt is a very common one that's, used to be just for abdomen. Now there's ones for perineum for like Kegel exercises. There are facial M-Sculpts. That actually increases the tone in the muscle. So the muscles actually contract, and it does give a lifting effect from doing that. So facial exercise, those kinds of magnetic muscle stimulations in the face, absolutely good techniques. And I mean, some of these celebrities might have had some of that as well.
How do you feel about radio frequency, like ulotherapy? Ulotherapy, I think is what it's called.
Yeah, so the ultherapy and radiofrequency different. So the ultherapy, if that's what you were mentioning, that one is ultrasound. So
Yeah.
ultrasound is focusing ultrasound through the skin, almost like you're focusing sunlight through a magnifying glass. If you focus ultrasound so that it heats and kind of focuses below the skin, it will contract collagen by heating there. So ultherapy is getting at those deep structures, trying to get them to get hot and make the collagen shrink. And it does work. Ultherapy is definitely a good technique. Radio frequency, similar idea. You're using radio frequency energy to try and get the tissue to heat it to a point that those proteins denature and shrink and contract. I think they're both good strategies. The radio frequency can be delivered. There are microneedling systems that can put that into the skin. There are minimally invasive face sort of liposuction cannulas where you can put a tube just under the skin, and that has radio frequency. There's benefits. You got to be careful when you're applying energy in or under the skin, because as soon as you do that, you run a risk, and that risk is causing burn, because you're trying to heat the tissue just under the skin so that it shrinks and tightens and brings the skin with it. But you don't want to heat it too much so that it heats the skin over top and causes a burn. So any energy-based device around the face, there is the potential for causing that. The ultherapy doesn't really do that because it can't heat that much. So there is more question of effectiveness. But anyway, all that to say, energy-based devices on the face definitely can be beneficial. Got to be careful, make sure you go through consent on that one very, very cautiously, so that you know what the potential risks are before you take that on.
We need to bring you back for a whole segment on non-surgical ultherapy, because there's also this whole discussion on ultherapy melting fat and then leading to like lack of like facial fat, which is all we're like holding on so much to our facial fat. It's the only place we really want fat in our bodies.
Yep, it's very, very true. The heavy people look jolly for a reason. It's because they don't have wrinkles, and that's one strategy to try and stay youthful. But it's not a very healthy strategy. So yeah, but you're absolutely right. Hold on to your facial fat. Don't give it up. It's really important.
Yeah. Yeah, Doreen is saying sometimes losing weight's not good for the face, don't you think?
Yep, you're right, Doreen. And in there's got to be a balance. I guess the first idea is do your best to maintain a healthy weight through your lifetime. That way there's not those kinds of fluctuations. Good health and good beauty starts as a child. Having a good healthy diet as a kid and a teenager, that sets you up for success. Once you get to the point that you're an adult and you recognize that you're heavy and you're not healthy, you lose weight. your face is going to deflate. There's no way around that. And some people it happens more than others. But then you got to ask the question, do you want to stay heavy so that your face doesn't lose volume and instead you're causing cardiovascular disease and cancer and metabolic syndrome and all that stuff? Of course not. The idea of compromising your health to try and maintain a full face so that you don't have wrinkles, that's foolhardy. I mean, nobody would think that's a good idea. So in the end, really the goal here is maintain a healthy weight always. But if you get to the point that you're not healthy, lose the weight. You got to prioritize your well-being. First goal here is stay alive and healthy. Then the beauty follows that. And if you're left with extra skin, maybe that means a skin tightening procedure or something like a facelift. To me, that's a better alternative. Or just accepting yourself as you are, but maintain your health. Your health is number one. You can't get that back.
Yeah, you have nothing without it. Okay, the moment of truth. We have a lot of people on now. Bring her up, baby.
Lindsay, I've been waiting for this one. So, you know what? Honestly, I think Lindsay is beautiful. I think she has always been beautiful, but wow, what a transformation for Lindsay. So I think the most pivotal thing for Lindsay is her health. Lindsay, when she looking back at those before pictures, the shadowing under her eyes, the hollowed look to her cheeks, the sallow look to her skin, the pigmentation around her skin, all of it. That was a person who was not healthy, and she knew it. She was not living a good lifestyle, and we all saw that. And wow, what a transformation. She is so beautiful and so natural. And so honestly, I think the most important thing that Lindsay has done is turn around her lifestyle. She is being healthy. She's exercising and eating well. This is like a whole new person, and it shows. And I think she is a poster child for a person who is being beautiful from the inside first and taking care of herself. And I think that that's manifesting on her skin. Now, having said that, there is some help here. And so, and that's okay. That's right. That's the thing. That's the right way to do it. Be healthy and be beautiful through health first, then add on those little things to help out. So let's first off acknowledge she's got a lot of makeup on in this second picture. So her skin, it's hard to tell what her skin is doing under that. But my best guess is I think she's had chemical peel or laser resurfacing. I think her skin has really been, treated and improved a lot. I think she's had some targeted filler. She has, same as we were talking about with Christina, she has, a very angled jawline. I think that Lindsay, she has a much more defined jawline, a little bit more corner to her jaw. That's some filler. Also, she, her cheeks, that kind of hollow look under her eyes that she had doesn't seem to be there anymore. I'm not so sure that's filler. She may have had some fat grafting done. Fat grafting is fascinating, and Lindsay may have had some fat grafting around her face, including the jawline. I mean, that might have been what she did there. Her chin does look a little more pointed. She might have had some put in there on her chin. Fat grafting, there are stem cells in fat. When you harvest fat from people through liposuction, that fat, about 1 in 300,000 of those cells is a stem cell, a mesenchymal stem cell. Those mesenchymal stem cells, MSCs, those carry with them growth factors and anti-inflammatories, and it actually improves skin quality over top. So fat grafting, when you do that, it actually changes the skin on the surface above it. I think she's probably had some fat put into her cheeks to kind of get rid of that little bit of hollowing that she had. And I suspect that that's contributed somewhat to the quality of her skin. So that's my overall assessment. I think that she has done a huge lifestyle change, put in a little bit of fat, maybe filler here, there, some neurotoxin, some Botox, softened up her look. But she is a new person, and I applaud her. I think that that's amazing.
Yeah, I agree. I think she looks happy. When you see her in her interview, she really does look happy. And I think that makes her look beautiful too. I know you guys are probably like, Gabby, cut the BS. Like, this girl, like, it's a full, but she looks, honestly, being happy, smiling, it makes a big difference in how you look and
You're
feel.
right. And I see the comment there from Cindy. Cindy, bravo. You're so right. Beauty comes from the inside. Love and happiness absolutely make you beautiful. And it's funny because it's a cycle. You know, being healthy and emotionally stable and fulfilled absolutely reflects on the surface of your skin. Emotional well-being in the longevity world, of all the different pillars of healthy longevity, nutrition, diet, exercise, lifestyle, sleep, psychosocial well-being, and emotional connectivity is number 4, and by far the most important. Those people who feel happy and are loved and loving and grateful, that absolutely has a very direct physical impact on all of your cells in your body. It changes your brain, your neural network. It changes your liver, your heart, your skin. All of that manifests. So by being happy and healthy, it shows on the surface. But as soon as you see someone like that, immediately you know that that's reflecting inwards and changing them physically. So being physically healthy shows on the outside. Being happy actually manifests and makes you more beautiful. Undoubtedly making her feel like $1 million. She feels amazing, and good for her. She earned it, and that's making her more beautiful, undoubtedly, and contributing to the long-term health of her skin and her organs for sure.
Oh, I love that so much. Doreen saying, can you move to Virginia and set up a practice here? Dr. G has the best bedside manner. We need more of that.
Thank you so much, Doreen. You're so kind. I'm licensed in I'm licensed in a few places around the world now, including California, but not Virginia. But I thank you very kindly for the compliment. It's very sweet.
You can't have them, Doreen. Okay, we need them here. Cycling back a little bit back to Lindsay, I have 2 things to say about that. First, I want to ask you about fat grafting. What's that like? Like, how does that work?
So fat grafting it's fascinating. Rewind 10, 15, 20 years, fat grafting wasn't done a lot, and it was generally not thought of as a good technique. There was a guy named Sid Coleman, who is generally considered as sort of the founding member of plastic surgery, that really popularized it, and sort of the techniques of how to take fat in a healthy way, keep it alive, and put it into places and have it survive. And there are a lot of different components to that. The way the fat is treated, there's centrifuging or separation, breaking it up into small pieces so it's not in big clumps, putting it in very small amounts in targeted places, not just sort of big boluses or big balls of it. So there are definitely ways that fat grafting has shifted over time. I personally think that in many ways, facial fat grafting has gone a little bit overboard, and there are people who I see who are overfilled. And it's actually a sort of, I'll call it a hot topic in plastic surgery, is the overfilled, the over fat grafted face. If someone has fat grafting and they gain weight, it can actually cause bloating and distortion, and it's not so good. And it is possible to overdo it with fat grafting. So it's an amazing technique, needs to be used cautiously in the right way to the right extent. But it's an amazing technique because it allows you to do those little contours here and there. It complements very nicely facelift surgery and facial rejuvenation, because often the facelift part is kind of the lifting structural part, but there's still volume issues, and you can't correct all of those with the lift. So adding volume here and there is an amazing adjunct to facelift surgery, but in the end, you got to use that cautiously. So fat grafting, great technique, and it's definitely grown, but to an extent that it's a little bit overdone in some ways.
Yeah. Ash, one of your patients, is here. This is such great information. Speaking as a patient of Dr. Corey Goldberg, he's the best, and I highly recommend.
Ash, thank you so much. It's a pleasure. I'm so glad you're able to join. Gabrielle is one of my most favorite people, and I love these conversations, and it's so good to have you here.
That's awesome. Can you come to New Jersey? Joni already said he's staying here with us. One thing that I wanted to talk about a little bit now, moving ahead, is an issue that my audience has discussed a lot, and it's something that I actually grew my entire channel on, and that's hair issues. If I pull back this photo of Lindsay, I'm not saying there haven't been changes in our face. There absolutely has. But you guys, hair makes such an enormous difference to how beautiful and rejuvenated and healthy someone looks. Like getting a different hairstyle, hair color in this case, haircut, it can completely change the way someone looks. They can look like a different person. And so something that I really struggled with was hair loss. I had significant hair loss, and I had to get a hair transplant actually in my mid 30s, early to mid 30s. And so this is something that your clinic does a lot of. And I would love to talk a little bit about that because it's a really taboo subject for women. And I don't think a lot of clinics offer it or offer it with women in mind. So do you want to talk a little bit about what you guys offer and that whole thing?
Yeah, absolutely. I guess the first thing is, looking at Lindsay, her hair, I agree, looks so much healthier, and a few different contributing factors. The, big one is her health, right? I mean, she's a healthy person now. She's eating well. It shows in her hair just as much as, your hair is part of your skin. Good health leads to good skin, and good skin is good hair. So definitely a contributing factor. The second thing, I think she was getting a lot of treatments done, bleaching, lightening, not good for you. I mean, that breaks your hair. Your hair is not alive in the end. The hair follicle is growing, but the hair itself is not. So over-treating, overdoing, not healthy. The other thing that people often do for their hair is, they'll put in, hair extensions and weaves. That is so terrible. Hair extensions and those kinds of things cause traction. They pull on hair. I know you've shared your experience. You had an experience with something similar with traction alopecia. So traction alopecia is, hair loss from pulling. When hair is under tension for a long extended period of time, such as, putting in weaves or extensions or wearing tight ponytails, the effect of that is actually to shrink and eventually actually kill the hair follicles. So, and this is a problem that's unique to women because, guys, generally speaking, have shorter hairstyles. Most of the time, they don't have ponytails. If they have them, they're not wearing them so tight. Women are often wearing their hair in very tight hairdos. And those ponytails that are really pulled tight, that causes thinning, often along hairline by the temple, and that manifests with traction alopecia. Another place that's really common is actually in the military. Because of course, military, women are expected to have the, really tight buns and their hair up. And that traction often over time results in thinning. And that was exactly the thing that you faced. So, when women have that traction alopecia, the answer, first off, remove the problem, get rid of the traction. If you're wearing weaves or extensions and you're starting to see some thinning, don't respond to that by putting in more of them, because all you're doing is accelerating the problem. When you identify that that's happening, take away the traction, get rid of those things, start focusing on health. And a hair restoration is a reasonable thing to consider for those kinds of situations. And, that's obviously what we went ahead with for yourself. The traction that from the tight hairdos that you had, that area, and it was a very focused area that we work on. I think it was maybe 2-3 centimeters across on each side. One was a little bit more than the other, but a hair restoration is a great solution for that. And the FUE, where we go in follicle by follicle, the follicular unit extraction FUE, taking follicle by follicle from the back where hair is healthy and isn't subject to that kind of traction, and then putting it in. It's a really great solution. When it comes to traction alopecia, there's no medication. There's nothing to really manage that. When those hair follicles die, they're gone. So, hair restoration for traction alopecia for women is a very common thing, and we're doing lots of that.
Yeah, it's a slippery slope. Like you get used to it and you don't notice it. And I was in ballet and I had my hair in these tight buns like all day, every day. I was in ballet all the time and I pulled it so tight and it gave me that ponytail lift and I loved how it looked. And I would just like the tighter. And the next thing you know, my hairdressers are saying like, well, what's going on here? And I'm like, what do you mean? And then it became the slippery slope where it just became, the follicles died. I went to a dermatologist. He looked at it with like a microscopic tool thing. And he's like, there's no follicles. I can't stimulate this. I can't give you steroids. And so I didn't have any other choice because at that point I had like almost no hair from here to hear. It's still like, I mean, this is after the transplant. It's a remarkable difference, but I really had almost no hair at all here. So I had a lot of hollowness, and I couldn't wear my hair up almost at all. Because I looked bald, and then I was thinking of getting a tattoo to fill in the. I was trying to get solutions by making things worse, like adding extensions. I just made it worse, and then maybe I'll get a tattoo so that you can't see the scalp, and then that would like be very invasive to my scalp.
Yeah.
And eventually I just did it, and it was really great that you offered that, and that we talked about it, because it's so embarrassing as women.
You know what? You're absolutely right. It's for women. I encounter lots of people who have emotional burden from what they see in the mirror, or how they feel about themselves, and it's both. All genders face that. When it comes to hair loss and women, I would say they are among the most emotionally devastated people that I meet, and it's because anything else you can kind of hide it, or there's a way. Women, when they start having thinned hair, there's very little to do, and for a guy, you start having thin hair, you lose some hair, you shave your head. For women, it's not quite so acceptable. So the emotional distress that causes is immense. And my hair restoration patients that are female, the difference it makes to them is immense. So for women, typically it's either traction or central loss. There's usually male pattern and female pattern baldness are different. Usually women start to lose it down the middle, and it starts to kind of thin off to the sides, and that kind of hormonal thing does respond to health and diet and lifestyle. And I always make sure to talk about that with patients. But hair restoration using a hair transplant is also very applicable for those patients too. So for women, this is a good technique. It comes as a part of a bigger picture. And Rachel, your question about having really fine, thin hair, you're absolutely right. You got to try and maintain that. And so my advice, honestly, pharmaceuticals are not the right way to go here. The right thing to do here is a healthy lifestyle. Minimize your animal protein intake. Try to have a plant-based diet. I would recommend 95% of your calories coming from the ground. The effect of animal protein on you, not good. That definitely contributes to hair loss. Part of hair loss is around the blood vessels, around the hair follicles. So when you start having blood vessel disease as you age from eating high sugars, animal protein, those things absolutely contribute to hair loss. The other thing is weight. Heavier people, especially women, hormone regulation gets a mess, and that is a big contributing factor to hair loss. Heavy people who have metabolic syndrome, that is, hair is one of the first ways that it will start to manifest. So, Rachel, your question, the answer: make sure you keep your health. Keep your weight under control. Try to eat a nice healthy diet, and that's plant forward. Your exercise contributes to that as well. Exercise reduces oxidative stress. The other thing, which I probably talked to you about, and I'm sure, Gabriella, that I gave you around your procedures, I really am a big fan of this thing, Glycodin. Glycodin is this oral antioxidant, and I didn't really recognize what it would do for hair. I've been using it myself personally for about 15, 16 years now. My patients were the ones who said something to me. I used to give it to them around surgery, and many of them would come back and say, Dr. Goldberg, my hair is thicker. Does this pill affect my hair? And I'm like, you know what? It does. And it reduces oxidative stress and inflammation everywhere in the body, including the skin. So that absolutely does result in thicker hair. So, Rachel, keep healthy, good diet, good lifestyle. Glycodin, Glisodin is how you spell that stuff. You can order it on Amazon in both Canada and the US. That stuff is like magic. I would highly recommend that.
We'll link that. Okay, we'll link that. I had a rhinoplasty. I had hair transplant surgery with Dr. Goldberg, but I also had a rhinoplasty. And I believe you made me go on it 2 weeks prior to my rhinoplasty for healing. And I stayed on it, I think, a month after. And
Yep.
It significantly reduced my healing time. Not that I can compare it to another rhinoplasty that I never had, but I mean, in 2 weeks, I looked great. And there's a lot of people that you see that have had rhinoplasties where it is a drama to heal from that surgery.
Yeah, well, and I introduced that into my practice exactly on the premise. I honestly, I introduced it. I didn't really know that it was going to make any difference. I didn't recognize its power. And then when I started having my surgery patients take the stuff, their recovery was, night and day. At first, I thought, wow, I was about 2, 3 years into practice, and I thought, oh, wow, now I'm getting really good at what I do. My recoveries are so. And then I stopped and thought, this actually changed kind of at the same time I started having my patients take Glycidin. And that, from that, I started really kind of researching the stuff and seeing what it was about. And, I'm a huge fan. I'm going to be, I speak about it at longevity conferences. I'm going to be applying to the National Institute of Health in the United States with Glycidin to do testing called the ITP, the Intervention Testing Program. I think this stuff is really magic. I swear by it, and I'm now 15, 16 years on it. And this is my hair. I have not had anything done to achieve that. That's just it's my genetics aren't this favorable. I can tell you, my brother, my dad, not so much. So I'm the outlier, and I don't have an explanation other than the fact that I eat lots of vegetables and I take Glycidin.
I'm sure they love that, huh? You're the fan favorite at Christmas. We're going to link that for you guys. Okay, there's some questions asking about linking it. I know it's 7. Do you have time for 1 or 2 more questions?
I'm good. If people are interested, let's keep chatting.
Okay, so we have here, what about no hair on the eyebrows? It's a huge problem in maturing women. So is there, can you do a transplant for eyebrows?
So the answer is yes, but don't do that. Honestly, when you transplant hair from someone's head to eyebrows, it doesn't change the nature of the follicle. It comes with. So when you do that, you're basically taking hair that would have a very long multi-year growth cycle and taking it from the back of the head and putting it onto your eyebrow. It will grow as long as it would grow normally. So you basically put yourself into a lifetime of needing to groom your eyebrows, because if you don't, they will keep growing. And if you let them grow, they will grow, and you'll have, pigtails growing off of your eyebrows. So it's not that it's not possible, and it's not that it wouldn't give you hair there, but the nature of the hair is not really what you want, and it becomes a maintenance issue. So, I've seen patients who've had that done, and, for the most part, they're not happy about it.
That's good to know. What about back to hair restoration? How do you feel about oral minoxidil or even topical minoxidil, if we can just extend that?
Yep, for sure. Minoxidil goes by a brand named Rogaine, is the most common. Minoxidil is a great stuff, topical and oral. The topical version was sort of the more common, and it's still very useful. And the oral version is great, particularly for women, because the sort of most common pharmaceutical oral agent that helps with hair is something called finasteride. And finasteride is good for men and not women, because it's a hormone blocker. So it's not safe for women to take that. So, for quite a long time, we didn't really have a good oral agent for women to use. Minoxidil is a good one because it doesn't have any hormonal effect, but it does help with hair. It won't affect traction alopecia. So when this is a mechanical issue, you got to remove the traction. No amount of medication is going to change that. But if it's sort of female pattern, hormonal, age-related hair loss, absolutely, the oral minoxidil does help. It does have risk of blood pressure irregularity, so you do need very careful dosing and some monitoring around that. But yeah, it is very effective, and it's another hair. I think about like the kitchen sink. Everything that you can throw at it is good to put in, whether it's adding in a topical minoxidil, the oral minoxidil, some Glycidin, good nutrition. Hair, it's the manifestation of the health of your skin. Everything that you can do to keep it healthy, do it. So I think that oral minoxidil has a very good role, and especially because it's safe for women.
Amazing. Okay, thank you, doctor. No eyebrow transplants. I'll keep watching Gabby for makeup help for my brows. Oh, I love you so much. I matter here in the world. Here's a great question that I'm sure everyone's dying to know. Can anything in the world reverse gray?
That is a great question, and we're kind of getting there. And
Really?
yeah, there are some things. So where to go with this? So reversing aging of your hair is getting to a point where it's possible, and there are the potential for stem cell treatments and injections that may do that. There is the potential for peptides to do that, and also sort of general anti-aging. There are certain medications that actually can reverse aging, and you know, these are things like things that are senolytics that actually get at the senescent zombie cells in your skin. These are things that target the mTOR, the targeted rapamycin gene that we have, which is a major age-related longevity gene. So topical treatments like rapamycin or topical senolytic agents, these are things that can actually reverse the age of skin cells and potentially give you back color to your hair. So if a hair follicle is dead and gone, you can't grow a new one unless you surgically put it there. But to take a hair follicle and reverse its age, that's getting to be close. You know, I would say as a part of that bigger picture, stay healthy. You know, you know, the diet, lifestyle, sleep, good emotional, psychosocial status. That is the number one thing. If you can get those under control, the treatments that can potentially reverse gray, that's coming. You know, there are topical senolytic agents like spermidine, which is, you know, it reverses these aging senolytic, you know, senile zombie cells in the skin. So, you know, stay tuned. I've seen a lot of interesting things in the past few months, and you know, I don't know that we're going to be able to completely reverse gray, but I think we're going to be able to turn it back some.
Wow, it's fascinating. Everything's changing so quickly in plastics. It's crazy.
Yeah, it's true. Things are really changing quickly, and I think it's part of a bigger picture where you know, the concept of beauty span, you know, the concept of maintaining beauty from day one, you know, from childhood, teenage years, keeping yourself healthy, making it so that you have good skin, good hair in the long term. I think that those kinds of longevity tools and healthy longevity, that is what's going to drive the beauty industry into the future. And thank goodness we're shifting away from beauty at the end of a knife or a needle. It's not just about getting things stuck in your face and getting cut up. It is really about staying healthy. And I think that that's the next thing driving the beauty industry. And surgery and treatments are going to be the things that kind of mop up and clean up whatever is left over and can't be managed that way. But I think that beauty from within and maintaining beauty span through a lifetime, that's where I think the industry is going.
Oh, I love that so much. And with that, let's get into our last question so we can let you go. You've been here longer than I said. Everyone always loves it when you come in. So I think this is a great question. Does eating less meat really affect hair loss? I've never heard of that before. Can you link some info on this, please? I'd be really interested in this.
Yeah, so you know, animal protein is a funny thing. So you know, one of the things that animal protein has, so protein is made up of amino acids. What we as humans, we have 20 amino acids. Most animals have these 20 amino acids. These are building blocks. And every protein that we have in our body, everything that exists is based on these 20 amino acids. Three of these amino acids, they are called the branched chain amino acids. And these particular amino acids, there are a lot of them in animal protein. And they're not very good for us. When you eat animal protein, you're taking in a bunch of these branched chain amino acids, and they trigger a lot of things in your body that you don't really want. You need these, you know, it's you know, you can't cut them out of your diet. However, when you have too much of them, it sends signals in your body that relate very much to managing inflammation, managing the sort of restorative mechanisms of your body, repairing DNA, you know, getting rid of cells that are unhealthy, taking care of your mitochondria and getting rid of old ones and making new ones. All of these mechanisms that have to do with maintaining your cellular health, all of these mechanisms are changed by what you eat, and animal proteins and those branched chain amino acids absolutely impact those mechanisms. So what that means, you're not restoring yourself as much. These mechanisms that have to do with rebuilding and getting rid of old cells or damaged cells, they are shut down. So then you accumulate more of those unhealthy cells. What does that mean? More inflammation. And that inflammation manifests everywhere in the body, the heart, the lungs, kidneys, and in your skin and around your hair follicle. So, when you are taking in the animal proteins, as well as the, high sugar, high glucose, fructose, all of those things, those are contributing to systemic inflammation. And systemic inflammation affects every part of you, including your skin. Your skin is your biggest, and in my opinion, your most important organ. And that's the issue with hair. It really causes inflammation, and those hair follicles shrink in response to that. So yeah, that's the animal protein thing. Every study that's ever looked at animal-based diets versus plant-based diets, roughly, and in animal studies where animals are fed different diets, 95% plant-based versus 5%, animal protein or less, has always shown a change in inflammation in all your organs, change in cancer rates. So, that's my best advice: a plant-forward diet, and try and minimize those animal proteins, because most of us depend on them and use them way too much.
Yeah, totally. Well, people are wondering if you have a channel, and I think you should start one.
Well, that's very kind. I'm thrilled to share information any way I can, and maybe a channel is in the future for me. My practice over the next year is shifting and changing to a point where I'm actually going to have access to physiology and longevity labs and a whole bunch of really amazing tools to provide my patients. And it's not just for my patients in Toronto. I'm really hoping to be able to grow this premise of Beauty Span and how to offer health to cosmetic patients through meaningful tools and helping to change lifestyle. So I'm super excited. And, as I get that established in my clinical practice and how I'm able to develop those tools, I will look to share it any which way I can. So, I won't rule it out. Let's say that.
Yeah, we have to have you back again, Dr. Goldberg. We have to talk about all of these other things, like living a really healthy life. There's just so much more than just blepharoplasty, really, you have so much more than that to share. And I love how you share it on your Instagram. So you guys, if you don't follow him, then definitely follow him on Instagram. You've been making lots of reels lately that are super helpful. And so I just am such a big fan.
Thank you. Well, I'm a big fan of yours, Gabriella. You're beautiful. You have always been beautiful, and the little touch-ups and things that we've done along the way, I'm so honored to be a part of that. And I really appreciate your realness with your followers, and the fact that you're open with the things that you've done, and how you've achieved your beauty. And I know that you lead a healthy lifestyle because I've asked you those questions. Yeah. So you look the way you do because you've worked hard at it over time. And I've contributed that little bit, and to me that's like, I feel so good about that. And I really love the way you share that with your followers, because I really think it helps them have a realistic view of beauty and themselves. So yeah, I'm a mutual fan of yours, very much so.
Oh, thank you so much. That's so sweet. All right, you guys. Well, thank you so much for joining us on your Wednesday evening. As always, stay safe, and we hope that you feel beautiful today. We'll catch you in the next one. Go follow Dr. Corey Goldberg on Instagram. Bye.
Bye, everyone.